Yeah, this is it's a state program where the states are actually managing uh, the risk contracts and are responsible. There's particular quality scores that need to be attained. There's total cost of care numbers and benchmarks that need to be met. And so the federal government, you know, I think that in the past, it's been the federal government and these agencies, right, that have pushed these requirements to health plans, and now they're getting the states involved. And so the states are actually going to be the ones. There's been 8 states that were selected. I don't remember everyone off the top of my head, but there were 8 states that were selected that will be able to provide this program. And so it's another program in the mix. One of the things that I think is interesting is that it's got a 10-year lifespan that they're going to test. And so it's far longer than any other plan has been given. So when you look at ACO REACH, right, or some of the other programs, the timeline on those are shorter unless they get picked up again. But ahead has been already extended for 10 years. And like I said, it's an opportunity for the states to manage the healthcare in their state. And what I find interesting is not in the first year, but I think I recall it's within the by the next year, they have to have a health plan partner. And so I really think that, and it says that they can volunteer, but I almost think that it may end up being well, we'll see. We'll see what type of arrangement we'll have there, but I definitely think that it will make things interesting by having health plans get into the mix and have them support these programs working in line with the states. And so I definitely think that we'll start seeing some movement here pretty soon. But I do think a lot of these programs and what's being put out um, is the intention is to see, who does it better and then take the pieces that are best potentially and put them together. We have Medicare Advantage, we have ACO REACH, so we're going to look and see how physicians can do it. We have a head, so we're going to see how at the state level that they can do it. And I think we'll just continue to see more programs potentially like this. I don't know who the governing stakeholders will be. I know you mentioned about hospice. We've seen some things come out around skilled nursing facilities, LTACs and things like that. So the long-term acute care facilities. So it'll be interesting to see if anything else gets added. But I think it's all one great experiment, and each of these programs is likened to a petri dish, and we'll see what comes out of them.